The spread of misinformation. It has led to many problems throughout the pandemic, from dangerous, unproven treatments to lies about what's in the COVID vaccine.
And Tallahassee Memorial Healthcare has been working to bust the myths to get the facts about the pandemic to families right here in the Big Bend. As part of News Literacy Week, they showed me how they're working every day to shine a light on the truth when it comes to COVID-19.
It's recommended that you get fully vaccinated.
Answering your questions about all things COVID-19. From the virus itself to treatment to vaccines, in 2020, TMH rolled out this website in an effort to keep the community informed.
From the very beginning, way back in 2020 when COVID, before it even came to our community, again, we wanted to be that resource for the community.
Stephanie Derzapolski's Chief Communication Officer with TMH. The team here updates how many people are hospitalized with the virus daily. They break down who's vaccinated and who is not. On top of that, they've got guides on the COVID vaccine and at-home treatments.
There's a wealth of information that masks work.
It's really hard to stay informed, so I think you have to trust the experts.
One of those experts is Dr. Dean Watson, Vice President and Chief Integration Officer at Tallahassee Memorial Healthcare and Capital Health Plan. He's working with Derzapolski's team to bust COVID myths as they spread.
The issue is that people can put things on the internet or use these platforms without evidence. And most people don't understand that. They look for their answers.
The team at TMH has tried to keep it simple. For example, this guide shows patients how to manage COVID at home, while they highlight monoclonal antibodies as a possible treatment. They tell patients to not use ivermectin or hydroxychloroquine, two drugs that some have said could work without the scientific evidence to back up their claims.
How does it feel when you do hear the reports about the misinformation going out there and people believing things that are just blatantly false?
It can be frustrating. I try to be patient with people.
When you're putting that information out there, what are the sources?
Obviously, you met Dr. Watson. He's been our primary resource, and he has a team of physicians that he connects with. So he's staying on top of the information coming from the CDC and all the other peer-reviewed information coming in. He's staying on top of it. He's keeping us abreast.
We still need to depend on the CDC and the Department of Health. They are the best resources. Are they perfect? No. No one has been perfect throughout this whole process. But are they developing better processes, better information? Absolutely.
And while TMH and the Department of Health can be good local resources to get your questions answered, there are also national resources aimed at stopping the spread of COVID misinformation. I'm including links to more resources to help keep you informed and healthy with this story at WTXL.TV.